Commerce, and we are here to kind of follow up on a webinar we did last week with Amy Kuhns with Henry County Counseling Service. Hi, Amy. How are you?
Hey, Gary. I'm great. How are you?
Good. Unfortunately, the webinar didn't record, so we're going to kind of go over what we talked about last week and some of the questions that were submitted, and just want to follow up so everybody has this information if they need it in the future at their fingertips. So we will just kind of jump in right quick. Amy, do you just want to get started and kind of an overview of kind of what we did, and then I'll get into some of the questions that we had.
Absolutely. So last week we talked about the COVID-19 and our mental health, our response, not just physically, but how we're all doing mentally, and making sure that we're doing everything that we possibly can to take care of our own mental wellness. So we talked about a bunch of different things. This is just a really, really uncertain time. This is a time that none of us have been exposed to anything like this before, and it creates a lot of anxiety. We get anxiety when things are out of our control and when things are unknown. And so dealing with the COVID-19 issue has created a lot of stress and anxiety for individuals, not just you and I and our everyday person, but especially those individuals that are already experiencing some difficulties with mental health issues in the first place. So last week we really talked about what are some different things to do in order to take care of yourself, what you can do to take care of your family, your friends, your parents, and how we can best look out for one another during this time, not just physically, but emotionally and mentally as well. So, Gary, if you want, we can just go through with the questions from last time, because I think I tend to kind of go into detail about pretty much everything I have that's important to cover during this time.
Okay, great. Well, I know one of the first ones that we talked about was kind of how we approach it and talk about it with our kids. Because a lot of times the kids,
right,
it's really different for them. They're not going to school. They don't know what's going on. So that's kind of one thing. How do we kind of help them with their fear and anxiety over what's happening?
Exactly. And so the main thing I'm going to say for our kids, and it's the same thing that I'm going to say to us as parents, is turn off the TV so that we're not constantly exposed to COVID-19 and coronavirus news. I know when this all began at our house, we had the 24-hour, 7-day-a-week TV going where we were just information dumping. It was an overload. And so, isolate your kids from what they're seeing on the TV and the news and what they're exposed to. But with kids are not dumb. Kids are smart little creatures, and they know something's going on, and especially our older ones, but even our younger ones as well. And so the first thing that you can do is, number one, just be honest. Talk about what's going on, and use terms that kids can understand, but doing it in a calm and reassuring way so that you're presenting it with comfort and ease, and to try to decrease their anxieties. You're definitely going to want to be honest, be accurate about your information. When you're telling them what's going on, be careful that you're not using any type of language that is going to blame others or lead to any kind of stigmatism, because any one of us can get sick from this virus right now. So just being honest, being accurate, making sure that they know how to take care of themselves physically, what they need to be doing in order to reduce passing germs to other people. Make it fun. Practice washing your hands, singing songs, just get them involved in it, but just be genuine and be there to answer their questions and to listen to what they have to say. And if they're scared, let them talk about that fear and anxiety, but comfort, be honest, short, sweet, and to the point.
All right, great. We talked about kind of just kind of depression from being quarantined, not being able to go out, not being able to do normal things and socialize with other people. So
right,
it's a good way to kind of cope with that.
Right. So I think you have to be aware of whatever that we're feeling right now is completely okay. And we're all going to be experiencing this in different ways. It's affecting all of us. But where I might be anxious and nervous about it, Gary, you might be sad. Another friend might be angry about it. And we're all going to have a different reaction, and it's going to come out in different ways. And so just knowing that that's okay. Making sure that you're in touch with what it is that you're feeling, that you own it. You hear a lot now about mindfulness, and that's a good buzzword that flows through the world right now. But being mindful of what it is that you're feeling, sitting in those feelings, and accepting them and being present in them. A lot of things that you can do too is just good self-care, making sure that you are eating correctly. I know when we first started, donuts and Oreos seemed like it was permitted now that we were locked up. We could indulge in those sweets, but being careful about what we're ingesting into our bodies, because crap food can make us feel like crap. So, we have the opportunity while we're all eating at the house or while we're supporting local businesses to order some good, healthy food. So making sure that you're taking care of yourself that way, making sure that you're staying connected. We talked last week about introverts versus extroverts and how different people are experiencing this in different ways. And our introverts you hear them saying that they've been preparing for this their whole lives, but really making sure that just because we are physically distancing ourselves from one another, we're social distancing, doesn't mean that we have to disconnect from the world. We are learning a lot of new technology that's been here for us, and now we're really utilizing it more than ever just to connect to individuals and to our friends and to our families, and making sure that you're staying connected. And a big thing with anxiety is, again, it's a lack of control. So identify what it is that you can control, and let the other stuff go. That's hard. It's very hard to get in, to not get into the mindset of what if, and is this going to happen, and what happens when, and just staying in the here and now, and not trying to guess what's going to happen in a month or 2 months, or catastrophizing about what's going to happen, but staying in the here and now and in the present and controlling what you can. You can control the fact that you're wearing a mask when you go out. You can control the fact that you're using good social distancing when you're around others. You can control your hygiene, your washing of the hands. So those are some of the things that you can control. Other things that we talked about were making sure we're exercising, getting out there, moving our bodies. The weather has been absolutely gorgeous. Before the COVID, we've had the rain all the time, and we're blessed with this beautiful weather. So get out there, move your body. YouTube has tons of videos, exercise videos. Be creative. If you have kids at home, or on Zoom with your girlfriends, have a dance party. Just move that body, and try not to be stagnant and still. I have some notes over here, so I'm going to look over and make sure that we look out. Another thing we talked about was helping other people. That when we help others, it helps us to feel good about ourselves. So what can you do to help other people, other organizations right now? There's a lot of organizations out there that really need assistance, whether it be by funds, whether it be by making masks, whether it's donating food. We could give in so many different ways. If you're out going to get groceries and you have a senior that lives in your neighborhood, can you go out and get their groceries for them? But really reaching out and doing stuff for others, that can boost our mood. It releases the good hormones and helps us from being depressed. So
that's all. Yeah, great information. And people kind of forget, everybody's using Zoom or some kind of platform now to do meetings, but you can also use that just to get together with people, just with your friends, right, or whatever. And we're actually going to do a virtual business after hours next week. So hopefully we'll get a lot of people that kind of.
I just saw that email. That's great.
Yeah, just jumps on there and just have a good time, and be able to see everybody that we've missed the last month. So yeah, hopefully that'll help as well.
Yeah.
Getting back to depression too,
Definitely.
and what is some of the signs to look for if you're worried about somebody in your family or one of your friends that you think may be having an issue with that?
Right. So we're all, like I said before, we're all going to have some mood fluctuations right now, and we might have some depressed mood. I think some of the things to look for is if you have somebody in your life who they seem to be depressed most of the time for over a 2-week period. That seems to be their constant stage, and that's when you need to start looking at maybe it might be a little bit more clinical depression going on than just the blues. And talking to that person, making sure that they're okay, checking in with them, encouraging them to talk about how they're feeling. If there's one thing, we can all understand this. We may not understand specifically how other people feel, but we can empathize, we understand. And so just allowing that person the opportunity to talk, and but really watching, and if the mood continues for 2 or more weeks, if they aren't getting out of bed, if there's major changes in sleep or eating habits, then that's something that we need to be aware of. And if, just listen, if they're talking more about dying or death, and really pay attention to that. And, unfortunately, we might see suicide rates increase. This is it can be a very depressing time, and isolation is very depressing. And so we need to check on one another. If you have a family member who you are worried is experiencing depression, anxiety, any kind of mental health symptoms, or you're concerned about their safety, mental health providers, we're still out here. I know our agency is open 5 days a week in order to provide services. It may not be physically in the building here at Henry County Counseling Center. We're open 3 days a week, but there's counseling agencies all around that are still accepting clients that are doing telehealth. And so connecting that family member, if you're really concerned, connecting them with the resources, and ask them to get help.
Okay. Yeah, that's
Mhm.
great. And I do think staying in touch. I know I talked last week about my dad, some of the things he's,
Yeah.
cooped up, and he wants to get out. And I've noticed kind of this last week, he's not wanting to talk on the phone a lot, but he's been calling me a lot more, and, just to talk, and just,
Yeah.
so I think that does help. Make sure and stay in contact with those family, and especially people that are by themselves. They're staying by themselves. I think
Yes.
those are some
And, and
great ideas.
Yeah, and focus on something else. I mean, we don't
Yeah,
always have to talk about COVID-19. There's a lot of
exactly.
other stuff going on in the world, and there's a lot of good stuff that's going on. So try not to focus so much. I know it's a huge topic, but spread your wings, spread that conversation out a little bit. So
All right, that sounds good. Very good advice. Let's see. We also mentioned last week is kind of an issue with some people that may already have a kind of a substance abuse issue, or maybe
right.
they didn't and they're starting to now. And this, I know this can be a time where people may lean on things like that more.
Right. Yeah. You definitely need to pay attention to your own drug or alcohol use during this time. I mean, this is a perfect situation in which people could isolate and begin to use more. Individuals that are already working on recovery and addiction issues might have a hard time right now. And so just remembering that there is support out there. And I know, Gary, we had talked about, and I provided some slides about different resources. And NAMI, the National Alliance for Mental Illness, they have a COVID-19 resource guide. So that is NAMI, NAMI.org. And you'll see their COVID-19 resource guide on there. It provides a lot of great resources for individuals who need the extra support. There's also what are called warm lines and care lines for individuals that are dealing with drug or alcohol issues. On the other end is somebody who is in recovery themselves, and so they can connect with that person and have that support. So we'll get those resources put up as well.
Yeah, absolutely. That's great. And we, all these webinars that we have are going to be on our resource page, which is togetherforhenry.com, the number 4. So we'll have that. There's a link from our website as well. So these will be up there. We're going to be